A short cycle, a long cycle, a missed period, these are not random. These are messages from your body. In the Why Ovulation Matters More Than You Think series, we've already talked about why ovulation and not menstruation, but why ovulation is the real start of the cycle in part 1. In part 2, we explored the 6 essential signs and how charting your cycles turns your body's daily patterns into a language that you can actually understand. And today, in the third part of this video series, we're going to build even more onto that foundation. I'm revealing what's really happening when cycles become irregular and how to read those irregular patterns as your body's early communication system. This is where body literacy turns into body wisdom, and I'm talking the divine wisdom, okay? So part of having true reproductive freedom is knowing how to recognize, chart, and interpret what your body is communicating. There's so much information about reproductive health everywhere, but so much of it is incomplete. And without full understanding, it's impossible to make fully informed choices about our bodies, about our fertility, about our overall health. And that is the very antithesis of reproductive freedom. And that's why inside my Master Your Cyclical Nature ebook and in video 2, I introduced the 6 essential signs that show what's really happening inside your menstrual cycle and with your hormonal health. So I want to revisit them really quickly before I move ahead, because these 6 essential signs are the foundation of everything that follows. So number 1 is the quality and duration of your menstrual flow. Number 2 is the pattern of your post-menstrual dry days. This is the pre-ovulatory or follicular phase of the cycle. Number 3 is the texture and color of your fertile quality cervical mucus leading up to ovulation. Number 4 is the day of ovulation. And number 5 is that post-ovulatory phase, particularly the length of that phase, which is also called the luteal phase. And then number 6 is the total cycle length. Each of these factors happens in this exact order, and it all has its own hormonal story that influence each subsequent phase. And altogether, these signs tell you how balanced or unbalanced your endocrine system is. Your endocrine system is the second most important system of the body. And when you learn to chart these 6 essential signs, you're not just tracking your period, you're observing how your brain and your ovaries and your thyroids and your adrenals and even your gut, how they're all functioning every month. This is real-time health information. That's what makes the menstrual cycle the most powerful diagnostic tools available to us if we know how to read it. And so I talk a lot about irregular ovulation and irregular periods, but what does irregular really mean? To truly understand, I like to start with the basics. What's considered normal? Now, keep in mind that normal just means healthy, all right? So under healthy conditions, your reproductive system is a beautifully balanced feedback loop between your brain, your ovaries, and your hormones. And it cycles through preparation, release, and renewal every month. Now, here's what's considered normal. According to the International Federation of Gynecology and Obstetrics, a healthy cycle occurs every 24 to 38 days. But there's some other studies that show short cycles as 22 to 25 days or less and long cycles as 35 to 40 days or more. But the overall average length is around 28 days. But remember, average doesn't mean normal for everyone. What matters most is your own individual patterns. Now, menstrual cycles that are considered regular usually vary no more than 8 to 10 days from one month to the next, all right? So if your cycles vary more than that, they're considered irregular. For example, you shouldn't be experiencing a cycle that's 25 days and then the next cycle is 40 days and then the next is 21 days, okay? That's what's irregular. And here's another key distinction. If you miss a period for 90 days or more, that's called amenorrhea, which means a prolonged absence of menstruation. So amenorrhea is one of the hallmarks of anovulation. Anovulation means there's a prolonged absence of ovulation. But you can also have the opposite situation. So some women actually do experience regular bleeding without real ovulation. And this kind of situation is called withdrawal or breakthrough bleeding. And it can easily be mistaken for a true period. And this is why charting is so powerful, because it helps you to recognize what's actually happening beneath the surface. If you're paying attention to those 6 essential signs and recording them on a menstrual cycle chart, the patterns on your charts are going to show you if ovulation has occurred and if you're actually having true menstruation. So remember, your menstrual cycle is driven by your endocrine system. So that's the system that governs your hormones. And we learned in part 1 of this series about a network of glands that includes your hypothalamus, the pituitary, the thyroid, adrenals, and your ovaries. So when this network falls out of sync, ovulation is affected, and then so is menstruation. And the first clue to what's really happening will appear right on your cycle charts. Back to the International Federation of Gynecology and Obstetrics. They're called like FIGO or FIGO for short, FIGO. And they classify potential ovulatory disorders into 4 main categories. So we have the hypothalamic, pituitary, ovarian, and polycystic ovarian syndrome. That's PCOS. And each disorder can have many root causes, from the physical and emotional stress and trauma to nutrient deficiencies, thyroid dysfunction, blood sugar imbalance, and insulin resistance, or even medication side effects. So when we're talking about anovulation and irregular ovulation, I want to unpack what those terms actually mean. So anovulation means that you're not ovulating at all, right? Irregular ovulation means that ovulation is happening inconsistently or unpredictably. And both of these ovulatory disorders, they can show up as cycles that's longer than 40 days. There will be some missed periods, spotting anywhere outside of that menstrual phase, or unusual bleeding patterns. Those bleeding patterns that's considered not healthy. And just a little side note though, both of these ovulatory disorders of anovulation and irregular ovulation, they can actually happen naturally at certain stages of life. So during adolescence, in the postpartum stage, especially while you're breastfeeding, after stopping hormonal birth control, and in the perimenopausal stage. So outside of those times, these disorders, they often signal an endocrine imbalance. Now, I want to go deeper into anovulation because there are 2 typical anovulatory hormone patterns. So Pattern A indicates low estrogen with occasional spikes. So in this pattern, you're going to notice long stretches of dryness during the pre-ovulatory phase. You're going to notice occasional patches of cervical mucus, but it never leads to ovulation. And then eventually a sudden drop in estrogen is going to cause a light flow of that dark colored bleeding. And that is withdrawal bleeding. Then pattern B indicates moderately elevated estrogen without the progesterone to follow. So you may see like ongoing cervical mucus that looks fertile, but it doesn't reach peak qualities. This makes more sense too if you know how to use the fertility awareness method. But the endometrium, which is the uterine lining, is going to keep thickening until those small pieces of the uterine lining, they shed off irregularly. Pattern B also causes heavier or prolonged bleeding, which is called the breakthrough bleeding. And in both of these cases, what's really happening is progesterone is remaining low because there's no ovulation. That imbalance, the estrogen without the opposing progesterone, can contribute to symptoms like PMS, breast tenderness, anxiety. I can go on and on. But even if your cycles look regular, research shows that 4 to 25% of cycles can be anovulatory. So regular bleeding doesn't always equal regular ovulation. And when you learn how to chart your cycles and you chart consistently and you start seeing the difference within a few cycles, these patterns is your body's red flags. Something in the communication loop isn't firing correctly. Now, let's zoom out and let's look at your cycle as a whole. Every cycle has 2 main halves, all right? So the pre-ovulatory phase, which includes the follicular phase before ovulation, and then the post-ovulatory phase, which consists of the luteal phase. So ovulation is that dividing line between those 2 phases. So let's focus on the follicular phase, which is in the pre-ovulatory phase. So this phase is right after menstruation ends. This phase is variable. Okay, the length of this phase can shift depending on your stress, illness, travel, nutrition, or sleep, but the average length of this phase is maybe 12 to 18 days. And when it's longer, let's say like 24 days or more, it usually means that your body's taking extra time to mature and release an egg. And that delay in ovulation can stem from like a sluggish follicle selection process, a delayed estrogen rise, or low nutrient and hormone signaling. But a longer follicular phase doesn't have to mean failure, right? It's often your body's adaptive capabilities just buying time to regain balance. Because if your body perceives that either physically or emotionally you're not a good reproductive unit, it will shut down or delay your reproductive capacity. It's actually a protective mechanism for you and your potential offspring. All right, so let's look at the luteal phase. So this half of the cycle is more predictable. Once ovulation happens, the luteal phase, it generally lasts 10 to 16 days, and the average length of a luteal phase is about 14 days. So if you have the skill of identifying ovulation, which can be done by paying attention to your cervical mucus and identifying the peak day and the basal body temperature shift, you can count forward to know exactly when your period is going to show up. So after charting your cycle for a few months, you're going to gain so much clarity with how long or short your individual luteal phase is. The luteal phase is a stable phase, right? It's not variable like the follicular phase. So that's how you're able to accurately predict the next day of your period, which helps when you're planning like life events, but that's another video for another day. All right, back to the luteal phase. All right, a luteal phase that's 9 days or less is considered short, and that can indicate low progesterone or some stress related hormone interference. So short luteal phases, they often bring on those unbearable PMS symptoms, the premenstrual spotting, and the difficulty conceiving. And if your luteal phase extends beyond 18 days, that often points to pregnancy, or occasionally something called a corpus luteum cyst, which usually resolves on its own, but it does deserve some monitoring. The whole cycle deserves monitoring. So when you're charting your cycles, and again, my ebook helps you to start charting, this is how you count your luteal phase length. All right, so from peak day, which is the last day you see peak type mucus, again, the ebook explains all of this. You're going to start counting at that first day after peak day, all the way to the day before your next period. And seeing your luteal pattern repeat cycle over cycle, it gives you incredible insight into your hormonal function. The follicular phase and the luteal phase, they don't operate separately. The health of your follicle, which produces the estrogen, determines the strength of your corpus luteum, which produces the progesterone. So a weak follicular phase means weak progesterone levels later on in the cycle, which leads to those irregular and disruptive periods. And if you notice 2 irregular cycles in a row or 3 irregular cycles within a single year, it's time to pay attention, because your body is inviting you to look deeper. Remember, the body doesn't have a language of words. Its language is the presentation of signs, symptoms, and sensations. The practice of charting the rhythm of your cycles is actually called fertility awareness. But this practice goes way beyond helping you prevent or achieve pregnancy naturally without the use of hormonal birth control. All right, it literally helps you to witness your health in real time. I'm telling you, when you start recording those 6 essential signs, you're going to start to see how stress shortens the luteal phase. You might notice that ovulation gets delayed every time you travel or you're under some type of intense physical or emotional stress. You're going to notice how better rest and nourishment can actually stabilize your overall cycle length. That's the level of awareness that leads to healing. The bigger picture is that irregular cycles aren't just period problems that we should ignore or silence with pain medication or suppress with hormonal birth control. They are whole body health problems, because your menstrual cycle mirrors your metabolic health, your thyroid health, your adrenals, and even your gut health. I can't stress this enough. If ovulation is irregular, your endocrine system is struggling to maintain harmony. And when you start charting your cycle by tracking cervical mucus, tracking basal body temperature, those are the main ones among some other signs, you begin to see those patterns clearly. That's how body literacy transforms your chart into a roadmap for healing. And the goal here isn't perfection. The goal is awareness, because knowing is just half the battle, right? When you can recognize what's normal for you, you're equipped to catch what's not normal before it becomes a bigger issue. And if it's already a bigger issue that your doctor is trying to address with, say, surgery and pharmaceuticals that don't fix the problem, this practice of charting your cycles can reveal what's causing the issue so that you can approach it at the root level for that long-term healing. That's why fertility awareness and cycle charting isn't just for conception or contraception, it's for overall health management. And when your cycles become irregular, it's your body whispering, something needs attention. The earlier you listen, the sooner you can restore balance. If this resonated with you, and if you haven't already, I really want to urge you to go back and watch the first 2 videos in this Why Ovulation Matters More Than You Think series. And then I want you to circle back and watch this part 3 again, because it'll make much more sense after the first 2, which lay the foundation for understanding why your period isn't the main event and how charting can help you understand your hormones with clarity. And stay tuned too for part 4, where I'm going to explore how your menstrual cycle connects to the rest of your body's systems, from your thyroid to your digestion, and why that connection is the missing link in all of these women's health conversations. All right, so remember, your cycle isn't random, it's responsive.